Assalamu alaikum wa rahmatullah. Today we talk about lymphedema. Edema means accumulation of excessive fluid in the interstitial spaces. Lymphedema means edema due to lymphatic vessel dysfunction. Now we start with the pathophysiology of lymphedema. Normally, the oxygenated blood comes through the arteries that supply the different tissue in the body, branch into small arterioles and capillaries to be aimed into venular system and into small vein tributaries, and then recirculated again into the right side of heart. This is the normal physiological phenomenon. During the following of blood in arteries and due to hydrostatic pressure, there will be extravasation of part of fluid from the arteries, arterioles, capillaries into interstitial spaces with part of proteinaceous molecule into the interstitial. So this fluid again reabsorbed and recirculated through the venular system and small venule to be recirculated. Part of fluid that extravasated from the bore of capillaries will stay in interstitial space and cannot be collected through the venular system, especially those who have large part or large molecule of protein. So we have another system of drainage, which is the lymphatic system, that starts by small network and some weighted to be increased and into between each channel. Between the channel there will be a lymphatic gland that contain lymphatic or lymphoid tissue. In this lymphatic system, there will be reabsorption of the fluid in interstitium, and because it has the characteristic feature of large pore, the large molecule can be reabsorbed again into lymphatic system and with other cellular debris and even bacteria in the interstitial space or in the subcutaneous tissue, and recirculated again into blood system through the lymphatic channel into the left side of the lymphatic system, the thoracic duct, and into jugular vein and right side of the heart, right atrium, and also in the left side, and in the right into the right subclavian and jugular vein to be recirculated again. So this is the normal circulation of the lymphatic system. Any derangement, any obstruction, any inflammation that lead to the dysfunction of this lymphatic system will lead to the accumulation of fluid and lymphedema. Classification, we have two types of lymphedema, primary and secondary. The primary, we have three types. The most common one is that occur in age of 35-year-old and below that age. This is called lymphedema precox. This is the most common one. And the second thing is the lymphedema tarde, which is occur above the age of 35-year-old. And we have another type below 1 year. They call it lymphedema congenital. For the secondary lymphedema, this is occur due to secondary or secondary to disease that involve the lymphatic system. For example, infection or infestation, which is the most common, by filariasis parasite present in globally and especially in tropical countries, that infest the lymphatic vessel and lymphatic tissue, lead to the fibrosis and cicatrization and to accumulation of lymph in interstitial space to cause elephantiasis or filariasis. Second is the tumor that involve different, for example, breast cancer with involvement or invasion of lymphatic vessel and obstruction. Surgery that resect some part of the body, for example, mastectomy with involvement of lymphatic system, which lead to the derangement of the lymphatic vessel and formation or consequently the patient present with lymphedema. The other is radiation, also affect the lymphatic system. TB, lymphangitis, involvement of the lymphatic vessel with TB. All these things will lead to back pressure into the interstitium due to non-drainage of the interstitium and infiltration by inflammatory cell infiltration, mainly macrophage, that produce substance, lead to a proteolysis of the protein substance in the area and lead to degeneration and pathological changes in the affected area. So this is primary and this is the secondary. Sign and symptom of lymphedema. The patient with lymphedema usually complain of heaviness and increase the size of the involved limb. And this evolved during the daytime. There will be more increase in size of the limb and decrease during the night due to drainage. At first, the edema is pitting because the soft tissue is still pliable and still not regenerated and indurated. And with the time, it will become non-pitting edema due to increase the pathological changes that occur in the area. The limb become thickened, enlarged, hyperkeratotic, rough surface, liable for multiple infection and cellulitis with constitutional symptom, become feverish, hot, red, tender, and swollen, and this condition become recurrent with the multiple infection. The other is the fluid will tear or weeps from the vesicle containing lymph. This is the characteristic or clinical manifestation of a patient with lymphedema. Radiological diagnosis: duplex ultrasound, important to see the flow. The other is lymphangiocytography using radioactive substance, and lymphangiography to assess also the patency of lymphatic vessel, and MRI also important to be as a diagnostic and assessing tool in case of lymphedema. For the treatment of lymphedema, we have two types of treatment: conservative and surgical treatment. Conservative treatment involves keeping the limb in a good or acceptable health by using strict skin hygienic measure to prevent infection. The second, to decrease the size and the width of the limb by elevation of leg. Second, external compression by using a special bandage or using a sequential compression device, mechanical or pneumatic, to compress the lymphatic vessel and pushing the fluid upward. The other is lymphatic massage, also used in case of infection and cellulitis, using of spectrum, broad spectrum antibiotic to decrease the infection. Also, benzopyrone drug used to react with the large molecular protein in the area and to prevent the formation of edema. In case of secondary lymphedema, we have to treat the cause concerning parasite, or in case of TB, lymphangitis, and so on. Surgical treatment: many attempts of surgical procedure had been done. One of them is Charles operation. Second is contusion operation. by excision of skin and subcutaneous tissue with attempt for pedicle transfer of lymphatic bearing tissue, or microsurgical procedure also used as a surgical procedure to decrease or alleviate the lymphedema. Lymphangioma. Lymphangioma is one of the malformation of lymphatic vessel. We have three types. Lymphangioma simplex, in which there will be dilatation of lymphatic vessel, capillary sized lymphatic vessel. The other is cavernous lymphangioma, dilatation of lymphatic vessel also occur, and the third type is cystic hygroma, in which the lymphatic vessel present as a cystic swelling, commonly in the neck and in axilla. And lymphatic cystic hygroma usually need excision with the preservation of vital structure in vicinity. Sclerosing agent also tried, but it is not so beneficial. Lymphangiosarcoma is a malignant tumor of lymphatic vessel, which is very rare. This can occur post lymphedema. For example, whatever the cause of lymphedema, primary or secondary. For example, in case of surgical excision or mastectomy, radical mastectomy, with lymphedema of upper limb. After a while, the patient present with lymphangiosarcoma, which is malignant tumor of lymphatic vessel, and the patient present with a purple nodule, skin lesion, rapidly and aggressively invading the patient, and it is a fatal condition.